I'll start with the first question. What are the most common heart conditions you treat?
So probably the most common things, there's the cardiovascular related conditions like high blood pressure, high cholesterol, and then the cardiac specific things like coronary artery disease, arrhythmias like atrial fibrillation, congestive heart failure. So it's a very widespread uh, disease state. There's a lot of different things that affect people in different ways. So there's a lot of different problems that we deal with patients that when we're dealing with heart disease in general.
Mhm.
What are some habits someone should have to keep their heart healthy?
So I think that's a great question because it's one of those things that I most of the time see patients after they've had cardiac issues or a cardiac diagnosis. It's much more rare to see patients before something happens. And so it's always refreshing to get patients that come in that maybe they're coming to see us because they've got a family history of heart disease, parents had heart disease, grandparents, those kinds of things. And so a lot of the habits that, I look at, talk to people about is just a lot of the basic things that we always say are good things, but definitely have a good impact from a cardiovascular standpoint. So it's a good diet. It's getting good cardiovascular activity. It's getting good sleep and getting good rest as well. And then trying to be more proactive with looking at different potential risk factors that you may have or may develop to try to be a little bit more proactive. So we're dealing with them before they become a bigger issue.
The third question is, what are the warning signs that someone might have a heart problem?
And so, that's a really good question because there's a lot of different things that given the different types of cardiac diseases could be warning signs. So obviously we always think about things like chest pain, and that's always the common thing. And from a chest pain standpoint, the things that are always the biggest concerns to me when somebody comes into the office is if they're telling me they're having exertional chest pain or pressure or tightness, because pain is just kind of a catch-all for any sort of chest discomfort. But so especially exertional symptoms, they're getting more short of breath, having chest discomfort, things that they don't get better until you sit down and rest. Other people may have symptoms of just getting more fatigued, more tired, or if it's somebody that's normally active and exercises regularly, feeling like their exercise tolerance has just taken a big dip. I always tell people, I say, everybody has a bad day in the gym, but if it's something that's now persistent and there's something that's changed, then that's worth looking into.
Mhm.
What causes high blood pressure and how can it affect the heart?
So that's a good question. There's a lot of different things that come into play. As we age, our arteries become less elastic. They get a little bit stiff. And, there's always that statement of hardening of the arteries. But we also have younger patients that develop high blood pressure or hypertension. And so there's a lot of different factors. And sometimes it depends on the person and their different lifestyle or their different genetics. But, there's lots of things that we look at that can contribute to the development of high blood pressure. So being inactive, obesity, taking in high salt diets. For some people, sodium really drives up the blood pressure. So those are all things that contribute to it. Some of the other things that we don't think about as much as sleep apnea, some of those conditions that we're getting more common in diagnosing and seeing that the wider effects that it has on people.
The next question is, can stress really harm your heart?
So stress can harm the heart in a couple different ways. So, we think of it, the day-to-day stress where, people most everybody in their daily life deals with a fair amount of stress. And so stress manifests itself in ways where we're getting poorer sleep. Maybe we're not taking as good care of ourselves. Stress can definitely lead to, higher blood pressure. And those are all things that can have kind of a long-term effect from a cardiovascular standpoint. But there's also certain scenarios where people can have acute stressful situations, whether it's physically or emotionally stressful events that actually can cause like an acute weakening of the heart muscle. Every so often, they'll talk about it in the news every few years where people call it like a broken heart syndrome. And so, or what we usually call it now is a stress induced cardiomyopathy, where somebody has some very acute stressful situation and it causes such, as best as we can understand, almost like an adrenaline surge that causes a weakening of the heart. And so these people can present to the hospital looking like they're having heart attacks, they're in congestive heart failure and these kinds of things. And they go through an extensive workup and we can't find any other reason for the cardiomyopathy. And ultimately it's when you start digging through the history and talking to the patient more and finding out that maybe there was this very stressful event that contributed to it. And obviously that's not something that affects everybody. It's a rare condition, but so that's kind of how different ways stress can affect the heart, either the long-term cumulative effect or sometimes these acute situations.
And our next question is, how do you diagnose heart disease?
So that's a good question. Now, thankfully, with cardiology and a lot of medicine in general, we have a lot of different ways to do tests on people, both non-invasively through blood work, through imaging, or invasively through different procedures. So, the basics of cardiology always is getting an EKG. So looking at, what is the electrical conduction through the heart. And so that helps us diagnose, do we have some sort of arrhythmia? What is the heart rate? Is there any evidence of atrial fibrillation? And then the EKGs can give you some hints and some suggestions of other things. Other testing that we do often is echocardiogram, which is an ultrasound of the heart, that it gives us a good structural picture of the heart. Lets us see if somebody has a weak heart, if they have any issues with any of the heart valves, those kinds of things. Blood work comes in often in the setting of if somebody comes in having chest pain. We get blood tests called troponins, and it's a heart enzyme that goes up when the heart is stressed. So it can go up in a lot of different scenarios, but always the most concerning that we're trying to tease out is whether it's something indicating that they're actually actively having a heart attack. Some of the other more complex tests we do CAT scans to look at the heart, MRIs to look at in different ways. When we're worried about looking at blockages, if we're looking non-invasively, it's doing things like stress tests, or if it's something that is more acute, somebody that we think is having a heart attack, that's where we take them to the cardiac catheterization lab, do an invasive angiogram where we're actually injecting dye into the arteries of the heart to actually see whether or not there are blockages in those arteries. And then that also allows us to then directly fix things if need be.
What role does diet play with heart health?
I think diet plays a huge role, especially from a preventative standpoint. But there's never a bad time to make changes to the diet. And that's what I always tell patients, even after having a heart attack, because we can fix blockages, we can fix problems, but we all still have the capacity to create more problems down the road. So I think we, as physicians, there's plenty of things that we can do medication wise, procedure wise, that can help these states. But there's got to be a foundation in a good diet and a healthy lifestyle, because a bad diet or a bad lifestyle can definitely undo a lot of the things that we are trying to do on the medication side. So it's especially helpful getting people to learn those good habits early on, even at a young age. So we've set that foundation to lower that risk of heart disease in whatever form it manifests itself later in life.
What is the difference between a heart attack and a stroke?
It's a good question. So a heart attack is essentially where there is injury happening to the heart muscle itself. So typically that occurs in the setting of somebody developing a blockage. And oftentimes it's a blockage that goes from maybe minimal or no blockage to significantly blocked or 100% blocked very shortly. That's kind of your classic heart attack, where somebody develops a sudden onset chest pain or similar symptoms, comes to the ER, they have characteristic findings on their EKG, and then they go to the cath lab and we find a blockage that we fix. So that's kind of the classic heart attack picture. So with a stroke, it's kind of the same idea, but it's relating to blood vessels in the brain. And so actually at different times, some people have kind of called a stroke a brain attack. It's not something that really gained a whole lot of widespread use, but it's the same kind of idea, because both scenarios, it's a lack of blood flow to a certain area of the body. And so with a stroke, it's oftentimes that a certain territory of all the vasculature in the brain has reduced blood flow, oftentimes due to a blockage similar to an artery of the heart causing a heart attack. And so then it's a matter of treating it somewhat similar and somewhat differently, obviously.
And next question is, can heart problems be inherited?
Heart problems definitely can be inherited. It's not always the case, but there's definitely situations where you'll see, and we see it as physicians, where you see a patient and they say, well, everybody or every male in my family had a heart attack by the age of 45. So there are definitely genetic components, and it's something that I don't think we have totally identified, genes that are markers of people that are more likely to have coronary artery disease or heart disease. There are certain scenarios, certain cardiomyopathies like hypertrophic cardiomyopathy, something that we often see in younger athletes, or that's kind of where you see it most popularly in the news, there are definitely some genetic associations there, and there's actually genes that we can test for to kind of help risk stratify family members or try to identify people before they develop problems.
Is heart disease a major problem throughout the world? And why do you think that most people don't understand the prevalence of this issue?
So it's definitely a major problem. I believe it is still the number one cause of death in the US. I know at times it's varied back and forth between cancer, but I believe currently it is still the number one in the US. And the last data I looked at from a few years ago from the World Health Organization, I think it was still number one worldwide. And so I think the hard part is it's so prevalent, but it's also so variable because there's so many different forms of cardiac disease that kind of fall into that picture. And so it makes it harder to, educate everybody on one aspect of it versus the other. I think it's also one of those things because it's so universal. I think a lot of people don't think about, how do we prevent it or how do we treat it? And I think that's where it falls on us and everybody else to try to educate people about, warning signs or how to be more proactive and preventative for these things. Because I think, a lot of patients, some that I see, they expect things like that to happen because it's happening to all their family members. So I think it's on us to try to better educate people to let them know how we can make changes before we actually deal with a lot of these problems.
I heard that heart disease is very preventable, but is it actually like if you do exercise and have a good diet, but you are genetically predisposed, can it be prevented?
So that's a great question. And that's a conversation I have with people a lot of the time because, you know, unfortunately, and these are a lot of the conversations I have is that, you know, we can't do anything about your genes. That's the one thing that we can't change. Or I'll say, you can't change who you're related to, even if you want to. So it's that those are the patients that tell me we need to work even harder on trying to modify all the risk factors. So those are patients where, and really it should be the foundation for everybody. But when you have that strong genetic history, we know that you're more likely to develop things regardless. So we have to do as much as we can. So it's things like, a good diet, exercise, maintaining a healthy weight, and then being really proactive with dealing with the other risk factors. So high blood pressure, high cholesterol, diabetes. If someone's a smoker, that's another big one that we need to look at. How do we, modify that? How do we get somebody to quit? And a lot of these habits are, not things that can change overnight, but it's definitely things to work on. And that's why, when we see people in the office, we're not just seeing them once and never again, because it's still a process to keep working on. So it's hard because yes, I have those patients that, run marathons and are vegetarian and have done everything right and still develop heart disease. And those are the really frustrating ones because, we can't ask any more than what they've already done and we still develop those problems. And so there's still more to be discovered, I think, from a heart disease standpoint. Because if you can get more to that root cause of it, then we can impact a lot of people before they actually have events while still trying to encourage all of the healthy lifestyle. But we've also got a lot of people that you can see that they've been proactive. They've made changes because they saw how their family members developed heart disease. And, maybe we're at the very least delaying development of things, or in some of them preventing those kinds of things from happening.
Okay.
But it's a tough one. It really is. And that's a hard conversation I have with people a lot of the times because we can't change the genetics of it, at least not now. And so that's where I say we've just got to throw the kitchen sink at it and try to hit all the other risk factors as much as we can.
What age do they typically like get heart disease? Like the average.
So that's a good question. And I feel like it's a number that is changing. You typically thought of people developing heart disease, having heart attacks, or having to have stents put in, things like that, when people are reaching their 50s, 60s, 70s. But there's definitely a patient population where we see it a lot younger. I'm trying to think of the youngest person that I have taken care of that has had a heart attack, and I want to say it was 26. So there's still those outliers where it doesn't, it doesn't fit the usual. But so I would say typically we're starting to see the heart disease issues in the 50s and 60s with kind of the outliers in the younger ages. But I think that's where a lot of those people, that's been years of those risk factors already, laying the foundation to then set things up. And that's why I think it's so important to treat people or see people and be more proactive at a younger age so we can prevent that development or slow that development so it's not as big of a problem, or we put them in the best chance to succeed when they do develop issues.
How common is it for like younger, like teens, 20s, 30s, for those like that demographic to get heart issues?
Thankfully, it's rather rare. There's certain scenarios. Familial hypercholesterolemia is an abnormal cholesterol production. It's a hereditary condition that people can develop severe coronary artery disease even as a child. But again, thankfully, it's a very rare thing. So we don't see those kinds of patients very often, but it does happen. And I think we see it a lot more in people that either they've got a strong family history or a lot of other conditions that are already working on the heart. Because people type 1 diabetics, you can develop diabetes at a very young age, and so not everybody is able to control that as well as others. And so those are sometimes the patients that we see earlier heart disease. Maybe not in teens or 20s, but still earlier than the general population.
Sounds good. Thank you. That was all we had.